The Alternative Digitalk. Real issues, real talk.
Fellow citizens, following the sequence of events, Uganda seems to be at political crossroads.
I'm not a servant of anybody.
Madam, I know the law.
As such, Alternative Digital brings you the Interface Show with retired Colonel Dr. Kiza Besuje.
Let's keep on the same page on Alternative Digitalk,
As he gives you the alternatives on the transition question, rule of law, human rights and freedom, youth inclusion in governance, economic stagnation, as he confirms.
I'll be always here Saturday from 10 a.m. in the morning. Be there.
Don't miss the live discussion on the Alternative Uganda, Digitalk TV Facebook pages, and the Alternative Uganda YouTube channel.
The Alternative Digitalk. Real issues, real talk.
Buterevu live, loud and clear kansubira buli omu ampulira mbaniriza nnyo ku mukutu gwa Digitalk TV ennaku z'omwezi ziri 13 omwezi gwa December omwaka 2022 tutuuse ku nkomerero y'omwaka guno gwennyini tugitandiseeko mpola mpola ennaku ndooza zibulayo nga 17 ntubenga guno omwezi n'oguno omwaka gwennyini tugukuba emabega mbaniriza nnyo mwenna wonna muli mu kutulabira enkya y'olunaku olwaleero mu abali wabweru w'eggwanga tubaniriza mu ngeri enjawulo oba akensuso mwebale kubanga muteze Digitalk TV enkya y'olunaku olwaleero wano we tuli mu kuweerereza we tuviira wennyini Makindye ku offices zaffe akakuba nno katonyera ddala budde bwakinyika gobegwa akyali ewaka making sure weefunirayo endooza ka jaketi oba aka umbrella akanaakuyamba mpolampola kubanga kirabikanga olunaku lwaleero enkuba egenda kubanga efudde emba mu bitundu ebyenjawulo eby'eggwanga naddala wano mu Central Uganda e Kampala we tubaweereza wennyini so gwali mu kuva obuva ewaka making sure nti no weekolako bulungi funa jaketi yo weetegeke bulungi afuna ka umbrella osobole okunoonyeza ekigulira magala eddiba zonga we mbagambye ennaku z'omwezi 13 tubulayo endoozi ennaku nga 12 tubenga tujaguza birthday ya Yesu Kristu tugenda kuwanga tujaguza Ssekukkulu ennaku z'omwezi 25 buli mwezi ogwa 12 buli mwaka tubeera wano nga tucelebratinga obulamu bwa Yesu Kristo omuntu eyajja endoozi emyaka nga 12 emabega naye paka essaawa zino omwami oyo bakyamwogerako kikulaga amaanyi omuntu oyo gayina so tutandise okubanga tumaliza omwaka resolutions nga Farida bikobere watera okubanga abagamba wano wazisetinga wazimaliriza waza completioninga oli ku ddaala ki eryokwakiringa gozo kyekyo ekibuuzo kye tulina okukubuuza enkya y'olunaku luno olwaleero. Bikyali mawulire bingi. Pulezidenti w'eggwanga wetwogerera ali wabweru w'eggwanga ali mu kibuga ekya London mu ggwanga erya Bungereza yagenze kubanga amitinga ku investors ab'enjawulo mu mbeera bwetyo. So tugenda kuba tukunyumiza ki ekiri eyo. Of course wana amalirizaawo agenda kuba asalamu yeeyongere wali ku North America mu ggwanga liri erya United States of America. President Joe Biden yayise abakulembeze ba Africa abakunukkiriza mu 29 era President Yoweri Kaguta ati bwabula Museveni teyalutumidde mwana naye agenda kubanga abeerayo. Bannayuganda bangi abaweze enkolokooto omuli ne aba NUP wano nabadde n'omwami General Moses Pigirwa olunaku lw'eggulo n'akakasa nti nno kakati ye kennyini waaba alinnye mu ggwanga lya Amerika abazungu bagenda kuba abannayuganda abali eyo mu diaspora bajja kuba bamulaga obutali bumativu bwabwe. So mu mbeera bwetyo bye tugenda okuba nga tunyumyako olunaku luno olwaleero era ne mu World Cup tujja kutunulayo mpola mpola tulabe kiki ekigenda mu maaso. Tuli ku ddaala lya semi-final oba eddaala erisembayo olyoka ofune eryakamalirizo second last, that is the semi-finals. Tugenda kwogera ku ttiimu ez'enjawulo engeri gye ziyimiriddemu olunaku luno olwaleero. Amanya nze Edgar Matthew Karuhanga okubanga okuweereza nkola ne Digitalk TV wano era twasalawo ffe okubanga tukyusa engeri gye mukozesaamu social media especially Facebook naddala mu ggwanga lye tulimu kati nga ne Facebook ekyali nzigale. Ffe tukkiriza nti munnayuganda yenna asobola okuba nga aweebwa akaagaanya okuba nga ayogera engeri gy'awuliramu oba ebirowoozo bye eby'enjawulo. So mu mbeera bwetyo twatandikawo Digitalk TV eno nga tukkiriza nti ojja kuba ng'olaba buli kimu ekiba kigenda mu maaso mu ggwanga at the comfort of your homes oba at the comfort of your tablets oba ng'otudde wonna woowooli kasita oba ng'olina ku data osobola okuba nga weeriisa enkuuli mu mbeera bwetyo. So gwe atamanyi mukutu guno tuli ku Facebook ne ku YouTube The Alternative Uganda oba osobola okutunoonyanga Digitalk TV ojja kulaba ku videos ez'enjawulo ze tukoze. Osobola okuba ng'opartneringa naffe mu mbeera ey'enjawulo. Guno n'omwaka gumaliriza guweddeko osobola okutandikawo partnership naffe okutandika mu 2023 and beyond because nga omanyi embeera y'ebyensimbi akaseera konna muba muzeetaaga. So osobola okupartneringa naffe ng'okola naffe mu programs ez'enjawulo. Osobola okusalawo okusponsoringa show The Mighty Drive ino weeri ebirayo buli lunaku lwa Monday paka ku lunaku olwa Friday okuva ku ssaawa emu paka ku ssaawa 3. Osobola okupartneringa naffe mu mbeera bwetyo tulabe engeri gye tusobola okuba nga tutwala kino ekintu mu maaso. Tulina n'emirimu egy'enjawulo gye tukola omuli live streaming ey'emikolo eya event yo eya program yo yonna. Tulina emirimu emirala tukola photography, videography, tukola events management nayo. So in case oyagala kuba ng'otegeka omukolo gwo osobola okuba ng'otwettanira. Kubira programs director w'ekifo kino bamuyita Mr. Mukose Arnold Anthony. Enamba eri noti 7 noti emu 8 noti 2 oba 07 01 800 212. Osobola okuba nga omwefunira ne munyumyamu emboozi mu ngeri gy'olaba gy'osobola okuba ng'okwataganamu naffe mu mbeera ey'enjawulo. Nammwe ba private partners tetubalinaako buzibu abantu nga ba Conrad Adino Steve Tankas musobola okuba nga muwagira omulimu guno mbeera yonna ne tulaba engeri gye tukozaamu amawulire ga Uganda n'eggwanga awamu. Ndowooza nga tuvudde kakaawo katuyingireko mu mawulire ag'enjawulo agabadde gagenda mu maaso mu ggwanga. Tutandikireko wano mu ggwanga lya Uganda. President Yoweri Kaguta Bwabula Museveni yatandise already trip ye gye yatandise nga atandikira wali mu kibuga ekya Uptown mu kibuga era ekya London mu ggwanga erya Bungereza. Yagenze kubanga meetinga wa investors ab'enjawulo mwakkiriza nti no bano bagenda kubanga basponsoringa Uganda mu mbeera yonna. Museveni yonna abadde so keen mu mbeera y'okubanga attracting a foreign capital mu ggwanga lino erya Uganda oba ba-investor abeebeeru basobole okuba nga bateekamu ssente zaabwe mu ggwanga erya Uganda. Ebintu ebibadde bikyalemesa Uganda okuba nga ekulaakulana innovations zibadde zikyali wansi ate nga ne ba-investors betera okulilayingirako babeera ba foreign investors abaleeta ssente ez'ewabweru. Naye ng'ate ejjuka Uganda erina abantu abakunukkiriza mu miliyoni 49. Bano bonna singa twali tusobola okufuna kye bayita domestic capital ne tuinvestinga mu bintu byaffe nakyo kisobola okuba nga kikola. Naye President Museveni mu mbeera eno y'okuba nga Uganda yeetaaga ku nsimbi asazeewo okuba nga meetinga ku ba investors ab'enjawulo abali mu kibuga ekya London basobole okuba nga balaba ku ngeri gye basobola okuba nga bateeka ssente mu ggwanga lino erya Uganda. Muzungu atera kiyita lobbying. President Museveni yabeera first citizen era abasobola lobbyingira eggwanga mu mbeera bwetyo. So twogerera nga agenda kuba nga ava mu ggwanga lino erya Bungereza ndowooza bwe bunaazibira olunaku luno olwaleero asobole okuba nga asalamu wali okweyongerayo mu ggwanga erya United States of America. President Museveni ono mu United States agenda kuba nga meetinga POTUS. POTUS bamuyita the President of the United States omwami Joe Biden. Bwe yayise olukuŋŋaana lw'aba African leaders ab'enjawulo abantu ndowooza African leaders abakunukiza mu 29 be bagenda kubeera mu ggwanga erya United States basobole okuba nga battaanya ku nsonga ezigasa Africa ate mu mbeera eyo nga womanyi President wa America wakuyita buli omu abalina okugenda agezeeko okwogera okusakira abantu be akasimbi kasobola okuzza mu ggwanga lyasobola okuba nga alikulaakulanya mu mbeera bwetyo. Bo Abannayuganda abali wabweru w'eggwanga baweze enkolokooto bagamba nti President Museveni ono byakoze bannayuganda bingi era yeetaaga abe nga bisasulira era bagenda kuba nga babyogerako mu kaseera ak'emabega ndowooza mujjukira omwami the late Honorable Speaker Jacob Olanya. Omwami ono yagenda okuba nga afuna obujjanjabi mu America ndowooza mujjukira ebyaliwo abantu balaga obutali bumativu bwabwe nga bagamba omwami ono akoze ne President Museveni mu kubanga batabangula eggwanga ate okuba nga bayisa bubi bannayuganda mu kaseera ako kennyini. So mu mbeera y'emu twalabye omwami ono President Museveni ng'agenda naye katulinde tulabe engeri gye binaaba bitambula wano nabadde nga nabagambe n'omwami Moses Bigirwa okuva mu NUP yagambye mbu tebagenda kubanga basiizinga obanga abakendeeza bagenda kusigala nga balaga obutali bumativu bwabwe naddala eri President Yoweri Kaguta Wabula Museveni omwami ono gwe bagamba nti no akijjanyiza eggwanga lino erya Uganda okuva we yajja mu bukulembeze. Jjukira President Museveni otwogerera nga amaze emyaka gijo 36 ng'akulembera eggwanga lino erya Uganda. Omwaka ogujja ndowooza zibeera ennaku z'omwezi 26 omwezi gwa Gatonnya oba January tutera okulaba nga President Museveni ne NRM ba celebrating okubanga bawamba batera kiyita teresita obudde bwe bawambiramu government ya Obote 2 ndoza zali nakoze omwezi 26 omwezi gwali gwa January omwaka 1996. So myaka gigenda kubanga giwera 37 bweddu okuva President Yoweri Tibuhaburwa Kaguta Museveni lwe yakwata obuyinza mu ggwanga lino erya Uganda. President Museveni nga abadde amaze nakadde nga takyafuluma wabweru w'eggwanga kubanga akola meetings bweziti naye guno omwaka gwennyini naddala nga guli mu kumaliriza tulabe nga abadde atambula mu mawanga ag'enjawulo yaliko wali mu ggwanga erya Senegal yatambula muko nayambuka ku walindoza mu ggwanga erya Vietnam gy'abadde awuno kati agenzeko mu ggwanga erya Bungereza agenda mu ggwanga erya United States abadde agezaako okutambula ne wano twamulaba yagendako mu Tanzania agenzeko wano mu Kenya abadde atambula mpola mpola okubanga maybe agezaako okubanga akosa international capital eyo abenga connectinga mpola mpola abadde takyatambula nozera embeera namwe mbadde mugirabe ebadde embeera ya COVID-19 kirwadde kyalumima mawuggwe naye kati President Yoweri Kaguta Museveni alabika yagiinize confidence asigale nga atambuza eggwanga mu mbeera bwetyo. So yoyo omukulembeze w'eggwanga omwami Yoweri Kaguta Museveni ali mu ggwanga erya Bungereza wetwogerye essaawa zino agenda kubanga aveeyo yeeyongereyo mu ggwanga erya United States of America. Ziri eddakiika 2 azeza kayita ku ssaawa emu ey'okumakya nze Edgar okubanga nkuweereza olunaku luno nagambye ennaku z'omwezi 13 omwezi tuli mu gwa December omwaka 2022. Obugovuza emigozo bano egigenda maaso mu palamenti y'eggwanga gikyali mingi. Pasis Namuganza bagamba bagala kubanga bamugjamu obwesige nga minister wa ebyettaka state minister for lands Pasis Namuganza. Pasis Namuganza ono bagamba yayisa olugaayu mu palamenti y'eggwanga lya Uganda munengeri gyekolamu era teyalaga speaker kitiibwa kyennyini ekimugwanira naye mu mbeera bwetyo ba MPs ab'enjawulo abamu tebakkiriza mu mbeera yakugjamu omukyalo ono obuyinza nga bagamba ensonga emugisaamu obuyinza si yaggumba nnyo according to mu ndaba yaabwe ey'ebintu. So Pasis Namuganza ono bamuteekako first of all okutoobola parliament oba ekitiibwa kya parliament naye nga kino kyonna kiva ku ttaka liri ery'Ennakawa Naggulu omukyalo ono libakkiriza nti no yawandiikako n'asayininga ne liweewa abantu abatalina kubanga balifuna nabagambye mu bantu abaafuna ettaka eri omulimu ne Apostle Grace Lubega owa Faneru Ministries Uganda omwami oyo n'abantu abalala b'enjawulo naye ng'ate agomu kubogalaga nti Pacis Namuganza ono yakolera ku orders eza President Yoweri Kaguta Tibuhaburwa Museveni yamu ordering anagama nga kosa rights ze nga president Pacis Namuganza asobola okubanga agabalina ettaka nga aliwo ba investors abenjawulo naye mu mbeera bweti Uganda abamu tebakkiriza mu nsonga bweti ate naddala ba MPs mu parliament abagamba nti omukyalo ono engeri gy'abadde yeeyisaamu okuva ku kiri ekisanja kya Rebecca alitwala Kadaga paka ssaawa zino abadde ayisa nnyo olugaayi mu baspeaker ne ba parliamentarians abenjawulo ye Pacis Namuganza agamba mbu bino bonna bamuteekako matu ga mbuzi kumuliisa ngu nga ye akakasa nti nno olutalo luno luli personal era nga luva ku mukyala deputy in fact she's a speaker now omukyala speaker wa parliament Anita Among agamba omukyala ono agezezaako okuba nga amukijjanya ku mbeera gye yataddemu nti biva ku ndowooza nsonga z'abasajja bawa Pacis Namuganza yali registrar wa embaga y'omukyalo ono Anita Among ne Moses Magogo mu mbeera yetyo tebakwatagana so ye obusungu abumalira ku mukyalo ono yennyini Pacis Namuganza so Pacis is playing the victim and of course Anita Among etanavaayo mu kigambo kyennyini kugamba mbu oba kino na kino naye it is what it is katulinde tulabe engeri gye binaatambula mu kati bw'otunula parliament y'eggwanga naawe kennyini weewuunya ng'ogamba ate parliament yo efuuse eki kino erabika efuuse kisekerwa buli omu ali mu kusekerera parliament y'eggwanga lino erya Uganda so byebyo ebigenda mu maaso katujja kuba nga tubabulya engeri gye binaaba bitambuddemu naye kati parliament yo yafuukira ddala kintu kisekerwa ndowooza olunaku lweggula balabye ku sessions ezabadde mu parliament ng'omwami Kabanda yadde agezaako okulaga obutali bumativu bwe eri engeri Pacis Namuganza gy'abadde akolamu emirimu mu mbeera bwetyo ye Kabanda ono Kabanda no MP we Kasambye eyo avuddeyo n'akakasa eggwanga nti omukyalo ono waliwo leaked information oba amawulire ge yawulidde nti Pacis Namuganza alina engeri gye yatyobolamu ekitiibwa kya parliament ku WhatsApp group ya ba minister nti alina we yabisomyeko nga bikakasa nti omukyalo ono yalaze nti nno yayina engeri gye yadde avulugamu ba MPs ng'agamba bonna bali common bayina ndooza amaalo directly kyayogedde ekyo naye nga kyeyadde alinga ategeeza so omwami ono ow'Ekasambya yagenze ku floor ya parliament n'atandika okuba nga abakanya n'ogwokwogera ebigambo ng'asamwasamwa kyengenda okugamba yasamwasamiza n'ebigambo era ebyamuleetedde emeenya wetwogerera nga omwami ono bamugambye aleeta obujulizi obulaga amawulire ago gye yagajje ate of course ne ba ministers bano abagamuwadde beebuuza ani yennyini eyaliikinza amawulire ago okulaga nti Pacis Namuganza kyeyayogedde ku WhatsApp group yaabwe so parliament yasabye omwami ono aleeta obujulizi obubacking accusations ze ezigamba nti omukyalo ono yatyobola ate n'ekirala ye amawulire yagajjeewa agaba minister ye atali minister amawulire agajjawa agakakasa ebigambo Namuganza byeyayogedde ku WhatsApp group ndowooza n'ekitiibwa ky'aba minisita nakyo obanga kiyisizaamu olugaayi okuba nga otandise n'okuba nga owuliza oba olumika ebiba bigenda mu maaso mu ba ministers aba cabinet so mu mbeera bwetyo kino bagambye nti parliament y'eggwanga ennaku zino yafuuse ekisekerwa balinga baana b'omu katale ebintu bingeri ennaku zino kye babikolamu ndowooza ba honorable si bwe batyo bakola we batwalamu ensonga eziba zigenda mu maaso mu ggwanga ndowooza byebyo ebya Pacis Namuganza ngenda kuba mbiwummuzaamu we binaaba byeyongeddeko nja kuba mbabuulira wano ku The Mighty Drive era weekuumireko osobole okuba ng'omanya ebinaaba bigenda mu maaso mu parliament y'eggwanga lino erya Uganda tufulumeko ko wabweru twogereko ku William Ruto ono nno ye president omuggya w'eggwanga lino erya Kenya bamulonda guno omwaka gwennyini era amasendoza emyezi 3 bweddunga akulembera eggwanga lino erya Kenya olunaku lweggulo badde baselebratinga ndioza giweza emyaka ndoza ebisanja 5 okuva in fact decades 5 myaka gikunukiriza mu 5 n'okusoba okuva we bafuna obwetwaze bwawe mu 1964 ndoza mujjukira ffe twabasookayo no 1963 yes bo bafuna mu 6 esatu. So bawezezza ndoze ebisanja 5 nga bagezaako okubanga baselebrating okuva bejjako abana abaami abamusibira mu bwa colonialist ababafuga okuva eri ndoza mujjukira muzibu Mau rebellion. Mu mbeera bw'etyo omwami ono William Ruto yabadde agezaako okweexplainingira eggwanga biki byafunye mu myezi 3 gyokka gy'abadde mu buyinza, ate kyasinza okubanga ateekako essira kyekintu ky'okubanga Hustler move agireso ba Hustler Fund. No Hustler Fund yes ke kasente ba hustlers abali mu Kenya abamuleta mu buyinza ke basobola okubanga bettanira kanono okakozanga mobile money n'ogenda ne weewolayo kasimbi n'okakozesa n'osobola okubanga okasasula n'okazaayo mu mbeera bwetyo. Yagambye olunaku lw'eggulo we lwaweredde ndoza nnaku lwakuno okuva ba launchinga the Hustler Fund abantu abakafuna sente bangi nnyo era sente zaakagabibwa zirimu obuwumbi bwa sente za Kenya. Ezo ziba sente nyingi around 3.75 billion ze zaakagabibwa nga zigabibwa okuva mu eno Hustler Fund mu mbeera bwetyo. Ate of course abantu abakasasula ensimbi mu zino ennaku ennya bakaziza ensimbi milioni 4 ebya Kenya. So yagambye mu eno trajectory ennungi nnyo era bannakenya ab'enjawulo bonna basobola okubanga bafuna sente zino. Abakafuna sente nga bagambye abakafuna sente ziri mu buwumbi busatu 3.75 billion. Of course balina ne ndoza abantu abakazifuna generally bo balinga milioni 15 bebakasobola okwaccessinga funding eno egenda okubanga eyamba ba hustlers oba abantu abafuna sente bamufuna mpola basobola okubanga bafuna akasente ke basobola okuinvestinga mu business yaabwe ate ne basobola okubanga bakazaayo embagirawo. So William Ruto yabadde mu kujaguza luno olunaku ng'ageza bagiyita in fact oba Jumuiya Day. Yes, it's a Jumuiya Day gye batera okubanga baselebratinga mu ggwanga erya Kenya. So olunaku lw'eggulo babadde wali mu kibuga Nairobi ng'agezaako okuexplainingira eggwanga engeri gye litambulamu naye nalabye engeri gye kyade ekintu ekirungi really something that is beautiful okulaba nga omukulembeze w'eggwanga asobola okukola accountability eri bannayuganda eri abannansi b'eggwanga eryo. Totera kisanga mu mawanga agagano ga Uganda. Ndoza kamalirize ne World Cup olunaku lwaleero tugenda kuba tulaba eggwanga erya Argentina nga lizanya eggwanga erya Croatia. Argentina kulembeddwamu omwami Lionel Messi. Ekikopo kino kyekikopo kyokka kyatanafuna mu career ye. Abantu abasinga bamuyita the greatest of all times. Agenda kubanga akulembera eggye erya Argentina okubanga basobola okukuba eggwanga lino erya Croatia basobola okubanga bagenda mu final wadde abantu bangi bamwagaliza naye okukuba Croatia tekigenda kuba kyangu. Balina omusajja namukadde Luka Modric omusajja akuba amakati bulungi nnyo era musajja bagenda kubanga bamwetaaga okubanga bamulookinga out from mpira oguwedde yasamba omupiira gwali tremendous dakika 12 naye ng'akulaga nti asamba bulungi. Yajja mu Brazil by the way. Croatia yajja mu Brazil ku penalties ndoza mujjukira abasajja ba Neymar balyoke bakaaba amaziga ekikopo baali balowooza kidda South America. So unfortunately Croatia yajja mu Brazil kati egenda kubanga ezanya Argentina ate olunaku lw'enkya tugenda kulaba aba Morocco nga bazanya eggwanga erya Bufaransa. Omupiira ogenda okubanga gunyumira abalabi. Ashraf Hakimi omusajja ono wa Morocco abadde asambye omupiira mulungi ne banne barepresentize Africa n'abawalabu bulungi nnyo mu mbeera bwetyo naye banaasobola okubanga bakuba Bufaransa be ba defending champions. Balina ekisajja ki Kylian Mbappe ki Olivier Giroud n'ebisajja biri ku top form bonna bateeba bulungi. France is another force that you have to reckon with but of course that is football. Ultimately there has to be one champion. Katulinde tulabe engeri gye binaatambula olunaku lwaleero nga Messi agwinganyeko n'omwami Luka Modric. Era mu abatera okugenda wali ne musiba ebintu ng'ebyakapapula bino mbeere beegendereza kuba World Cup ono akakasiza nti mpaawo atalikaaba buli omu asobola okujja n'akushookinga mu mbeera yonna. Mwebale nnyo abaddeko ziri eddakiika 30 zezakaita ku ssaawa emu katuwumulemu katono we tukomawo tugenda kuba tweyongerayo n'emboozi. Farida Bikobera agenda kuba neegattako tunyumyemu paka ssaawa 3 ez'okumakya. Good morning.
The Alternative Digitalk. Real issues, real talk.
Fellow citizens, Following the sequence of events, Uganda seems to be at political crossroads.
I'm not a servant of anybody.
Madam, I know the law.
As such, Alternative Digitalk brings you the Interface Show with retired Colonel Dr. Kiza Besuje.
Let's keep on the same page on Alternative Digitalk,
As he gives you the alternatives on the transition question, rule of law, human rights and freedom, youth inclusion in governance, economic stagnation, as he confirms.
I'll be always here Saturday from 10 a.m. in the morning. Be there.
Don't miss the live discussion on the Alternative Uganda, Digitalk TV Facebook pages, and the Alternative Uganda YouTube channel.
The Alternative Digitalk. Real issues, real talk.
Amacha malungi abatukereddeko ku mpewo zaffe za The Alternative Digitalk. Farida Bikoberege manya gange njagala okubalamusaako ate era okubaaniriza ku programu yaffe ey'olwaleero The Mighty Drive ebeerawo everyday Monday to Friday essaawa ebeeremu ey'okumakya paka ate essaawa 3 nga tunyumyamuko nammwe ku nsonga ate ezitali zimu. Olunaku lwakubiri ennaku z'omwezi ziri 13 omwezi tuli mu December ate omwaka 2022 tunaatera okugumaliriza. Njagala okukubiriza ali mu December. It is a month of giving. It is a month of appreciating people. It is a month of spreading love. Banaye abantu bemwagala mbalage nti mubagala, families, friends, relatives, bona as in show love, because you'd never know what those people went through mujiri emyezi 11 kubanga ate mukama tuleseewo okubanga tumaliriza omwaka ogwa 2022. Njagala okubaaniriza okubategeeza nti sobola tosanga ku The Alternative Uganda on Facebook oba Digitalk TV both pages. Otekayo comment yo tujja kubanga ate tugisoma bulungi. Our quote of the day is it is bad enough that people are dying of AIDS, but no one should die of ignorance. It is bad enough that people are dying of AIDS, but no one should die of ignorance. So abanayo butamanya si kirungi nnyo omuntu tofuna bulwadde because ndowooza mbunze I didn't know how to protect myself against HIV AIDS. It is the reason olwaleero tokedde wano eno tulina omusawo agenda kubanga atunyumizaamuko. Batugambye tulina HIV prevalences nyingi mu baana abawala myaka 15 n'emyaka wakati w'emyaka 15 n'emyaka 25. Twagala okumanya what is causing it ate to finding any solutions. So munange njagala okusaba maama ali ewaka TV tumbula tetuwemula tuba tusomesa abaana bawulirize ate bayige. Good morning Elder Mashuka.
Good morning to you. How are you?
I'm good.
Yogedde ku nsonga ano naye ey'okugaba December is a month of Kogawa.
Yes.
Chigenda both ways. So now agaba na bakuwe.
Yeah, sometimes.
You know, there are people who just like to receive. Ate yali abantu ngabo bali comfortable receiving. So as you are looking forward to, being given, because the hand that gives is the one that actually gets so much. So now we go gaba ngaba kuwa now we gaba mpola. Abantu tebalina nsonyi, Farida. I think the more you grow, you realize that people are shameless. Very, very shameless. Oli abeerawo nga ye amanyira kuweebwa ng'ate naye akinamu emirembe okuba ng'aweebwa waakyo mu mbeera bw'etyo. Omugenyi waffe owaleero bamuyise Dr. Barigye Bonnie, omwami ono is a medical clinical officer. Agenda tubulya wajja akola. Tugenda kuba nga twogera ku kirwadde ekyamukenenya nga Farida wabagambye. There is a worrying statistic. 46 people die of HIV every day. And
158 get infected every day.
Awulira so ng'olunaku oluziba weeruti ne babakebeza naye nga tebanja abatali munaye mukebeza. This HIV is back. HIV yaluma abantu mu 90s naye ndoza tetwamuwulira bulungi kati akomyewo mu kino ekyasa ate asinze kukomerawo mu bavubuka naddala abawala abato. Ensonga emu esinza okuba ng'eweebwa nti abawala bano bagenda mu bavubuka abakulu oba mu basajja abakulu nga beetaagayo ndoza obuyambi naki ne basobola okuba nga bakomyawo obulwadde buno ne bayinfecting abavubuka bannaabwe. So tukyetewebuuza kivudde ku kina mbeera ki esobola okutuyamba okuba nga tulwanyisa kino ekirwadde ekyamukenenya. Mr. Barigye Bonnie tukwaniriza nnyo.
Thank you.
Luganda is not your favorite.
I'm going to try to.
You can
try to mix it.
To maneuver.
Hey, you have to survive. Some people call it the official language. Mr. Barigye, you're welcome.
Thank you very much, my dear hosts. I'm very happy to be here and share information, more specifically about life, because we need to live and live healthy and longer. So with the right information, some people should not die.
We have a generation that thinks that that thinks like they are going to die tomorrow. Like I don't know why we are so impatient in terms of money, in terms of fun, everything.
We do not care about the
and
future.
Every time I talk about that, Farida brings me out and says Edgar, I'm being bad. But this generation is a very myopic generation, just to say.
No, the thing is, people have this statement that is absurd. Life is short.
It's for the living.
Yes, it's for the living. It is short. It has created a lot of problems because someone has died, a friend has died, so life is short.
Yeah,
so someone makes irrational decisions to make it shorter. So it is already short. Why should you make it shorter? So let's try to prolong it.
Yes, and part of the things of prolonging is trying to taking care of yourself. Try to take care of yourself. Try to really put yourself first. Because if you did, HIV would not be the biggest challenge today. Talk about HIV in 2022. Today, what is the state?
Before we come to 2022, people know HIV and they know AIDS, but they don't know which is which.
Yeah, what's the difference?
It is the same. Actually, we know it is the same thing.
It is not the same.
Most people know it is the same thing. I am speaking for the majority. So, Edgar, if you know the difference, most of us don't know.
So, yes, the majority think it is HIV stroke
AIDS. But
no, not really.
HIV is the virus, right?
HIV stroke AIDS.
HIV is the virus. When you get it, it remains untreated. Then it progresses to AIDS. So HIV is the virus that brings AIDS. Like female anopheles mosquito.
So when you get infected with HIV.
Yes.
And then it transforms to AIDS.
If you don't get medical attention, then it progresses to become AIDS.
What is the difference between HIV and AIDS? Like, okay, apart from that, like, what is the difference in terms of someone who has got the disease itself, someone who has got HIV and someone who has culminated into AIDS? Is there a difference?
We have stages we shall look as we go. We have stage 1 up to 4. So stage 1, you've just acquired HIV. But if you don't get attention from medical professionals, you find you've gone up to stage 3, stage 4. That's why AIDS comes in. And it has a lot of other diseases we call opportunistic infections. The syphilis, the pneumonias, so they come in. So it is a disaster when you progress to AIDS. So it is better when you get HIV, get medical attention, so it doesn't progress and you die soon.
But can you actually heal from HIV?
Not really.
So it is all the same.
All the same.
Yeah.
There is no permanent cure
For HIV. And there is no permanent cure for AIDS, right?
Yes. But with the right medicine, which we call ARVs, you can slow down the infection. You can slow down the rate at which it is eating you. Then you can continue living very happy, very healthy.
And you do not infect?
No, you don't.
So this one of AIDS does not depend on ARVs. ARVs doesn't cholera.
I think we are going too fast. We need to first define what is HIV, what is AIDS. We look at the stages, then we can.
It's okay. Let's build it for someone. Okay, you know, HIV is something that we have grown up seeing, hearing, but it's okay. Let's just elaborate it to the people. So finally, how does someone catch HIV? Let's just do it from basic. How does HIV come about?
Well, those are the things we grew up studying, right from primary, secondary, and tertiary institution. It is very simple. HIV, it is got through sexual intercourse. I don't know, some language hours may not be for public consumption.
No, sex is okay.
Yes.
It's
So
they know.
when you have sexual intercourse with an infected person, there are very high chances that you're going to acquire HIV. But then someone will ask, we know people who the man is positive, the woman is negative, they have been together for years.
They are called discordant couples.
So the rate at which you can get HIV from someone increases when that someone has the viral load, which is very high. Viral load, I mean the viruses in someone's system are too much.
It's virus level.
Yes. Yes, it is very high. So it is very easy for you to get. But then when you take your ARVs very well, there's what you call viral suppression. You suppress the virus levels to a level that it cannot transmit to another person. That's why some people are able to live together for years.
Without infecting each other.
Yes.
So that means this person, when they take their medication very well, accurately, the viral load will go down. When it goes down, this person is unable to spread the virus.
Yes.
Wow, that is good.
And these pastors, I've seen some of them saying, I prayed for someone and they
got healed.
No, that one is not there.
Miracles happen.
That's not a miracle.
Miracles don't happen on HIV.
Not really.
I personally met someone who got cured of HIV.
You see,
through the church.
Yeah.
I'm not so much into arguing about religion.
You're not a spiritual
but
person, but you are a medical person. So scientifically,
it is not there. Those people, when you take your medicine very well, at some point, the viral load is very suppressed. You find it has gone into undetectable levels. You test someone and you cannot find it.
It's too fast.
Because the virus is in the latent phase, we call it latent phase. It is in the liver, the bone marrow, it is asleep. Someone is suppressing it very well. But then, some people are deceived that they are doing very well. So, we are going to pray for you. Stop the medicine. The moment they stop, that virus in latent phase wakes up. Then it eats you. Personally, I know some people have died because of that misleading.
Yeah, there is a problem with pastors. I hear that they really mislead their flock. Sometimes they will show you that you have healed, you're okay, and yet you're not. But in some cases, some actually prayed for and they healed genuinely.
That one I cannot.
I'm informing you. I'm not asking you.
I'll try to.
I'm informing you. But of course, science deals with evidence, and there is no evidence that the Lord
the
can
pastor,
heal.
yes, that prayer can heal someone who is.
Yeah, but until a doctor tells you that you have nothing to do, just pray to your God. There are times when that comes, right? When you're like,
you wait for your death.
Those are isolated cases.
Yeah, extreme cases. Yeah. So yeah, you've been talking about the viral load and how it happens and how these medicines suppress. So after what point is someone supposed to start medication?
In Uganda, we have what we call test and treat policy.
How's that?
So in the past, we used to test someone when they are positive, they are okay, they are not bad off, we send them home.
Yeah.
We say, you keep coming.
And we monitor.
We monitor. When we see the viral load going high, you start medication.
Yeah.
But then, some people, they never showed up.
Don't come back.
Yes, they don't come back. Others, they give up on life. They go and they start infecting others.
Yeah, it can be devastating. So very many.
So the Ministry of Health revised and said, when we test you and you're positive, you start treatment immediately. Even if the viral load is very low, but you start and then you can suppress it. So even if you say, let me infect many, there are very low chances that you're going to infect.
Oh.
Yes.
Yeah, because you're on medication, so but we together
Yes.
Okay, but even if but it's not also advisable to sleep around just for people in case you have a condition.
Some people are just.
Some people want to. They have given. They think having HIV is a death sentence, which is not.
More or less.
People have lived, and they are okay. So you don't have to give up on life.
Yeah,
you see,
but
with HIV, management starts from the time you go to test. Yeah. Even before we get a blood sample, we are already treating you, whether positive or negative. So we cancel you. So by the time you leave, whether positive or negative, you don't go when you have given up on life.
Okay, but let's talk about when I come to the hospital to test. What is wrong with your nurses coming up, showing all this sad face as if I am infected, even when I am not? And now they start cancelling you, you see, you do not have... And then in me, you are already sending me to thinking, oh my God.
I'm even telling you, the worst is that they will first ask you, even before they ask you, they give you the results.
When did you...
When did you? Then they ask you. In case your phone positive.
And she's even showing you one on the face. And in me, I'm like, why did you just give me my results and I see for myself?
I saw someone went for an HIV test. Then he overheard the nurses talking. Mubambi, he looks innocent.
And those are nurses.
Yes.
The nurses of this world.
A medical profession has studied psychology, knows how to counsel. And yes, when I'm going to get a blood sample from you, I have to give you options.
Yeah.
So that you don't collapse. So what if you're positive? Then you tell me how you will feel. What if you're negative? If you're a couple, what if one of you?
One of you is.
Yes. So when you tell me your answer, when the results come, I have the approach, the right approach. I can know how to approach you so that you go home when you are okay.
When you are contented.
So when you see doctors and nurses are discussing, you feel that is not professional. It should be discreet between a doctor and a patient. It shouldn't be a hospital discussion.
A joint union.
No.
No, but there is a way our systems have normalized those things. Like you go and, for example, I'm going to give you from another narrative of women who are giving birth. You find until opaka katona zara. You see those things. There are those statements. Go achari wano. Mujawe chejo. There is a way our system is just it's just okay, and because they've gotten used to, which I understand, they've gotten used to seeing these things, so they find them normal in their eye. Like you, a doctor, when you see someone with HIV, it's not a surprise to you.
Because
but this person who has got HIV is surprised themselves. So these days, why is it that the empathy is low?
Well, I can't speak for others.
Speak for
but
yourself.
That is wrong. In my work, things concerning HIV or even any other disease, it should be a matter for a doctor and a patient. So those who are saying those things, it is not okay and it should be stopped.
Is there another way someone can survive with HIV without taking ARVs?
Currently, we don't have a vaccine for HIV. We don't have a permanent treatment. The only way you can live longer
is by taking ARVs. There is no other option.
We've heard of an injection. How did the injection go?
Which is still in development. It is not yet out. So when it is out, then we can count it as an option. But for now, I wanted to first show you how the burden we have. The statistics. And we see how heavy this thing is.
Yes.
So, ever since HIV came on board, 84.2 million people have been infected. Globally. 84.2. And out of those, 40.1 million have died. So half of the number. In Uganda, we are 40 what million?
49.
So 49 minus 40.
3/4 of Ugandans passed on.
That's the global number of people that have died. By the end of 2021, globally, 38.4 million people were living with HIV.
By the end of what?
By the end of 2021. We are yet to know
year.
by the end of this year how many are going to be
living with HIV.
650,000 people died last year
due to HIV.
That is global.
By the way, when you listen to these statistics and you hear 650,000, you feel it's small, but when you break it down to an individual, that means there is someone dying of HIV. And this someone adds to another person who are 2, 3, 4, and then they enter 650,000 people. That's a big number.
So we come to Africa. Africa is the mostly affected continent.
Why?
1 in 25 adults, when you count 25 people, 1, 2, 3 to 25, one of them is HIV positive.
Omuntu omu ku bantu 25.
Yes.
Mulwadde. Buli woobala katubale wano tuwera 2. Omu kufa abeera mulwadde.
Yes. Literally, it is not like that. It's just a statistic.
Yeah.
So that is 3.4% of the population, which is 2/3 of the entire world. So out of 3, Africa, 2 out of 3, we account for the global infection.
Yes.
Yes, it started from here. That's what history says.
No, I would disagree with that history. It didn't start from here. That thing was manufactured from somewhere and given to Africans.
Not really.
Your assertions next time.
It's okay. Let's work in the history as.
Leaving Africa.
No, because I'm telling you.
Let's
continue.
We come to Uganda.
Yes, let's look at the PAL.
And adults 15 to 64, 6.2% of 49 million people are HIV positive.
Where here in
Uganda. That accounts for 1.2 million people.
Mu bantu abakulu?
Yes, 15 to 64. Females having higher prevalence rate. They are mostly infected at 7.6 and males at 4.7.
Oh, so it's almost double.
Yes. And there is a worrying statistic that I found you talking about. 570
women, people, in fact.
No, young women aged
yeah.
15 to 24. They get infected weekly. Count from Sunday to Saturday. And put 570
young women abana abawala wakati w'emyaka 15 25.
Yes.
Bikumu bitano. 500?
570.
Bikumu bitano.
I came and I gave that statistic here on the Mighty Drive, and I told people that the fact is 570 women.
HIV buli week.
Women get HIV every week.
Buli week.
Yes.
That's a big amount. Now we are going to start from there. Let's go in for a short commercial break, ladies and gentlemen. At that statistic that is really worrying. We're going to talk about that. Why is it that women have are the most prevalent in getting this particular condition? 570 women get HIV each and every week that goes by. That means you multiply how many weeks do we have in a year? In a month, that is 4. That is around 2,400 people dying, getting infected with HIV every day. This is a very big statistic. We want to look at it, what has brought it, and how we can solve it. And later on, we're going to also look at AIDS among pregnant women. How is it transferred to the child, and how can we protect the fetus from getting HIV? And also there is a bit of misconceptions around circumcision and its links to HIV and HIV reduction. We'll be talking about that and much more in the next hour of the show. We are still with Mr. Barigye Bonnie. He is a clinical medical officer, and we're talking about the state of HIV in the country today. My name is Edgar. Let's go in for a short commercial break.
The Alternative Digitalk. Real issues, real talk.
Fellow citizens, following the sequence of events, Uganda seems to be at political crossroads.
I'm not a servant of anybody.
Madam, I know the law.
As such, Alternative Digital brings you the Interface Show with retired Colonel Dr. Kiza Besuje.
Let's keep on the same page on Alternative Digitalk,
As he gives you the alternatives on the transition question, rule of law, human rights and freedom, youth inclusion in governance, economic stagnation, as he confirms.
I'll be always here Saturday from 10 a.m. in the morning. Be there.
Don't miss the live discussion on the Alternative Uganda, Digitalk TV Facebook pages, and the Alternative Uganda YouTube channel.
The Alternative Digitalk. Real issues, real talk.
Welcome back from that short commercial break. You're still watching The Mighty Drive. As we are going for the break, Dr. Barigye gave us a worrying statistic, and that is that 570 women get or acquire HIV each and every week in Uganda today. A very, very worrying statistic. We want to understand where does this statistic come from and why is it like this today? Dr. Barigye, please continue from where
a
you
recent
stopped.
study was conducted by UNAIDS in Uganda, and 570 young women every week.
These are women between 15 to 24.
15 to 24. And the real cause hasn't been established. But studies show these young women are looking for, there is an argument, it is not yet. But
They're looking for survival.
look, not survival, because every parent can look after a girl at 15 to 24.
But not every parent can look after a girl at 22 years or 22, especially those at campus.
We are looking at the basic needs.
Yes, I am talking about basic needs too.
You're not talking about. But there's a difference between a need and a desire.
And a want.
Yes.
So the parents.
Let me first break down the
Edgar,
needs.
don't break down for me.
No, the
I
needs
know.
are for the girls
I know.
out there.
I know.
The needs is shelter, food, clothing, basically. Shelter, food, clothing,
But do you know no
and
parent
water.
buys you clothing when you're at campus? You find out your
Continue,
own
doctor.
way.
No.
These guys are justifying themselves.
Let's talk about this.
Yes,
the 15 years old girl, 16, is in senior 4, senior 3, and up to 24, those ones are at campus.
Yes.
Now, in senior 4, if you're not in boarding school, you study and go home every day.
And there is that one of 16 that isn't going to school, that is at home because the mom cannot
We
afford.
shall come to that. I'm still on these ones who are in school. You study, you go home. If you're in boarding, you stay at school. They give you fees at school. There is posho, because posho and bean is the most nutritious food. So you have the basic needs.
Yeah.
But because of the peer pressure, you've seen Farida, she's your friend, and the parent is well off. So Farida has iPhone. We are on iPhone what now?
14.
14 is already out.
Yeah.
So we are on iPhone 14. Okay, Farida has Toro. iPhone Toro.
For you have your Kai
And for you have your Kai Phoenix like mine here. So now there is a big gentleman, there is an old guy in
with
his
a potty
30s,
belly.
yes, who has made money
Yeah.
and is ready to buy
iPhone 14.
iPhone 14.
iPhone 14. So this Farida's friend will just go. And those men they have HIV. Not all of them. I'm not saying all of them, but some.
But it's mostly prevalent in the elderly.
Yes. And they are looking, before they die, some of them, they think I'm dying. They don't know that you can live until your 80s. So before I die, let me infect this young
girl.
So he's ready to spend whatever money this girl wants. So this girl will get the HIV. But then this girl has a boyfriend who cannot manage the iPhone.
The iPhone, yeah.
But of course they are age mates, so goes to the boyfriend. So spreads.
Because of love. So he loves the
Because of
boyfriend.
love, yes, but due to material, goes their side. So we are seeing, we call it cross-generational sex. The old men are transmitting HIV to these young girls. So my advice to the young girls would be, there is more to life than iPhone 14 or 15 or 16.
Or a car.
Or a car, or a night in the bar. I've seen them.
Or an expensive apartment.
I've seen them, they want to have those bottles. But there is, when you study and finish, yes, we don't have jobs in Uganda, they are little, but patience. You can buy that iPhone. You can buy that car when you are okay. Don't go for these transitional pleasures just now, and then you lose the future. That's my advice to these young girls. Otherwise, this number is going to increase, and we shall see disaster.
And it has increased prevalently in 2022.
These young girls inga tebawulira. Since I am out of the bracket now, I can talk about it.
You're not yet out of
I
the
am
bracket.
out of the
You're
bracket.
just safe for now.
No, we can hear.
Because I even care. Say, okay, let's first hear your opinion. Since you're out of the bracket, the 15 to 24.
Yes,
And
Just the bracket she
she's in a better position to advise them.
Since I am out of the bracket, but what I wanted to tell Doctor is that these girls are not in school, and they're at home, and their parents cannot afford even the basic needs you are calling basic food, the basic necessities. It cannot afford them. So the parent themselves are going to force these young girls to go in for a relationship. Haven't you seen?
Even early forced marriages.
Yes, for forced marriages.
Especially in
Haven't you
rural
seen?
communities.
Yes, these young girls getting forced to marry some old men because the parent feels, oh, the man has promised to take care of the family, so the parent will force you.
I have a friend of mine who really got angry with the parent because she was being forced to marry this guy. And I would look at this guy, I'm like, you parents. And the mother is comfortable. She said, no, yet one, that is the money. And looking at the man, the man is an old man. The man is this pot-bellied man. He has money, right? But there is no purpose to the marriage.
And when you say no, they can curse you.
I'm telling you, even up to now, my friend has those wrangles between him and the family because they want her to marry a certain individual who she doesn't find appealing to the eye. I also don't even find him appealing to the eye as well. He just has nice
your opinion
cars.
No matter whether you find him appealing
They are
or
not
not.
together.
That's why.
So, you know,
That's why.
She's your girlfriend.
No, let's continue.
That's why every year,
Yeah.
December 1st, HIV/AIDS Day. It is not celebrated. We cannot celebrate HIV, but to raise awareness.
Yes.
So that's why we talk about all other factors that lead to the increased spread. So what you're talking about is covered. We are trying so hard, not only to give ARVs to test, but prevention. Talk to these young women, talk to parents, talk to everyone who can listen, so that more efforts can be put at prevention. Since when you get it, you cannot get treated completely.
Yes.
So we must, the government has to put in more efforts at prevention, more than the curative part. So we need to address all of that.
Zimbabwe has a nice saying that I enjoy. For them, we have ABC yeah, to end HIV. So for them, they added a D. So theirs is ABCD: abstain, be faithful, use condoms, or die.
That's
that is what they say. They say if you have failed to use all of these ones, please die.
But again,
that is next.
That one is.
Yeah, it is bad,
okay,
but you have
practically,
advocated.
You see, we don't want to give stigma. These people have already been
stigmatized. Yeah.
Yes. So we want to cover a wider scope, from person who has not yet gotten the infection to the person
the one who has got.
So if someone already has the HIV, we make sure they don't give up on life. We advise them, please take your ARVs. Please eat well. Because I know someone who died because a pastor, these pastors, they told her, now you are okay. Stop taking the drugs, stop eating.
And fast.
And fast. They could go to the mountains and pray.
Bakubaka dry.
Yes. So the virus that was at the latent phase woke up. So by the time the medical workers advised the woman to go back and take
her medicine,
it was ready to. We have what we call iris. So if you have HIV and you have these infections, pneumonia, syphilis, if you leave and then again you come back and take the ARVs, this infection can double.
Oh.
It increases the virus.
Hey.
Yes.
It was what I was going to ask you, like, when someone leaves medication and then they come back, why is it always worse?
I'm not a doctor there.
No mala no liddako. Ate omuntu abeera bubi nnyo atabuka.
Now, I want to take you through the stages. Stage 1, stage 2, stage 3, stage 4. When we understand that, then we can know when do we take the ARVs, when are we not supposed to take them, and the importance of adherence. You stick to taking. So, stage 1, and then I also want to talk about the testing. There's a vice I've been educating people about, but stage 1, we call it asymptomatic, where you have the HIV, you have just acquired it, but you're fine.
No
what
signs,
you feel,
no
we call them flu-like symptoms. You get a headache, a fever, but those are, you fear, they are not bad. Then we have what we can see is the lymph nodes being enlarged. The lymph nodes in Uganda, I don't know. These ones.
Amambuluga.
No.
Yeah, when they become enlarged, they become amambuluga.
No, I think those are mumps.
These ones, because
we have nodes.
Amambuluga
Ganagali no wansi. Those are called amakebe. I got to get amakebe mutoro.
Then here, so it is lymphadenopathy. Then stage 2.
I go get amakebe. Stage 2.
Stage 2. When you haven't been tested and started on treatment, then the symptoms continue. Those ones, the fever, so you start to lose weight. It is now eating, it is attacking the immune system. The viral load is going high.
Yeah.
The T lymphocytes, the CD4 cells, which fight, are going down.
Okay.
So you start to lose, in this stage you lose less than 10% of your weight. Now, if it advances to stage 3, now that's the advanced stage, you lose more than 10% of your weight. You continue losing. At this stage, you get the pneumonias, the syphilis, all those.
That's when you get AIDS.
Yes, that's AIDS.
Because now, because HIV has weakened the system.
No, it has, yes, the immune system.
Yes. So the immune system is fragile.
Yes.
This immune system has been attacked by various conditions. That's where you get flu, you have malaria.
There are no cases where someone has gotten infected but they're gaining weight because
I think
Doctor, tell us.
There, no, that one is not practical. We shall come to that.
Okay.
So, at the advanced stage, in the past, people used to get serious diarrhea. In that they could not get out of bed. They put a hole and
the basin down.
It was a disaster then. So when you go to stage 4, the severe one, all these infections that have come in stage 3, they continue.
They're doubled.
Yes, they are more severe. You lose weight, the pneumonias are there, the syphilis, the herpes zoster, everything.
Sometimes even tuberculosis.
Everything. And they are really, you die.
It's a point of no return.
Yes. Okay. But when you get tested and you're started on the ARVs, they interrupt certain stages of the life cycle. The life cycle it is.
Of the virus?
Yes. We shall not go into it because our audience, let's just keep it at the life cycle. It has 7 stages. So the ARVs target the virus at each stage. So it does not replicate, it does not multiply so fast. So the CD4 cells, they gain in quantity, they become many. The virus goes down. So someone is healthy. So if someone had started losing weight, now they gain.
They gain.
So your people start saying,
akawuka kasi mu mubiri.
yes. Because someone is adhering, eating well. Psychologically, someone accepts it.
Yakkiriza nti kirwadde weekiri kati katunoonye tufuuka.
Let me take the drugs and live.
Yes, please.
So the only way you can know that you have HIV
is by testing.
I have some boys of mine who say, that one doesn't have. No, from the
outward.
Yes.
By the way, they diagnose with eyes.
Yes. Even some girls, you will see Edgar, that one cannot have. Yes. So that is very dangerous. But trust me, when you get it, that's when you understand that what you were saying, you didn't mean it. So the only way is to go to a qualified medical personnel. They counsel you, then they take your sample. We have different ways of concluding that you have or you don't have. So here comes the vice I was talking about. In my practice, I've seen people come, they buy, they determine the rapid tests. Edgar has seen
self-testing.
So, and to be sure, I have to first pierce hands
and test there and then.
But then there's what we call a window period.
Yeah.
A window period is when you acquire the HIV. From that time up to the time when it can be detected. That's the window period. In that period, the virus is multiplying so fast, but the body is still fighting. So someone is okay.
They have it,
yes,
but it cannot
even
be
if
detected.
You test it, cannot be detected.
So if Farida got it 2 weeks ago, and you, Edgar, you're saying, let me buy these things, they will help me, no. So you will test her, she's negative. Because the virus is not yet at that level where it can be detected. So this one is safely in her window period. Also cheating, she doesn't know.
She doesn't know.
So you will say, no condom. We have tested.
She's negative.
You go, you land into that virus that is multiplying very fast. It will get you. 2 months later, you get the symptoms we were talking about. How? I tested, and you go and they test you, you're positive. That's why when we are testing someone, when we find you negative, we say come back after 3 months.
Yeah, for another test again.
If you're negative, come back after 3 months. When you watch the way you move in these months that we are testing, then at the end you're negative, then we can confirm you're negative. But you cannot just do one test and say, you go home now, you are fine. What if you're in the window period? And many people don't understand this. That's why we are getting more people get infected because of this self-test. So even when you're positive, they test you and you're positive, we don't conclude at that. There are certain levels. We get the sample here, we bring it here, then we can conclude that Barigye is positive.
Let's talk about the PrEP. They say when you sleep with someone, you do not whether they have or not, the following day you start PrEP.
We call it, yes, we have PrEP and PEP. PrEP is pre and PEP is post. So when I'm going to sleep with Farida, let's say, I'm not, it is
just an example, yeah.
So I'm not sure
whether she's positive or negative.
But I don't have access to condoms, I don't have. So it must happen. I wonder why it must happen and it can't wait.
Because it has to happen.
It does not have to happen. It's your mind that thinks it has to happen. There's a difference.
So you can take these drugs. So that even if she's positive, then the drugs already can fight the multiplication, so it doesn't get attached to the CD4 cells. You can be protected.
So you take it for how long?
Usually it is 1 month.
And they say PEP has also some side effects. It's not.
Very.
It's not
It is
an
not
easy
an
drug.
easy. That's why, if you can prevent, why should you take PEP? Why should you take?
Why would I go into a 1 month of taking medication?
So PEP, it should be for us.
That's what PEP does.
PEP should be for us, the medical workers. If an accident happens and I get pricked, I didn't intend.
Yes.
So that I can have my nightmares and.
You first explain, by the way, the
harness.
effects of PEP,
PEP.
to your mind. Because I have friends of mine who really think about PEP as one option. Like for them, if they sleep around, I shall get PEP. And please explain some of the effects of PEP to a human mind.
Like any drug, every drug has side
effects, yes.
But we are looking at a drug. But PEP, it is not a separate drug and ARVs. No, it is the same. Yes, we just make combinations and you take, but it's still ARVs. So they shouldn't think PEP is like Panadol.
It's
So
something
all
special.
along,
That's what I thought.
we've been thinking PEP is totally different from ARVs.
No.
It is ARVs.
Yeah, ARVs.
Another type of ARVs.
The same.
The
They have the same
same.
ARVs.
Yes, only that.
The combination is different.
Yes. ARVs, they are combination of first line, second line, third line, depending. When you default, there's a lot of chemistry. But
Why does PEP bring those side effects, the nightmares and all that kind of stuff?
you know, we are looking at the immune system. It is targeting to strengthen the immune system of your body. So it is not going to be easy to get attached to every CD4 cells to prevent the HIV from attaching to itself. So you get the fever, some people get jaundice, you become yellow, the eyes, it is not an easy. So my advice would be, if you're thinking about it cannot wait, I will take PEP. My friend,
PEP isn't easy.
is not easy. Even the health workers who get accidents and prick themselves, by the end of 1 month, it is not easy.
It's like a full year.
Yes.
Okay. There is someone who commented here, and he mentioned something that I wanted to. He says, but you should tell the people, it's called Kato Tumusime. He says, but you should tell the people that AIDS is not only transmitted through sex. It can be transmitted through other ways, unlike pregnancy. What are some of those other ways that HIV can be spread?
We didn't. So the major route is that. But we are going to talk about mother-child transmission.
Yeah, that one also.
So HIV can be transferred from a mother
To the child.
but it can be prevented. And if we shall talk about it.
Yeah.
Then another route is, ask the health worker. I'm working on Farida, she is positive. But as I'm handling the equipments, the needle
pricks you.
Yes, and it goes so far that Farida's blood gets mixed with mine. So there's a high likelihood that I'm going to
be infected.
That's when PEP comes in. But if you don't access it, then you can get HIV. Then another highest route is these unusual practices. I don't like talking about them because people should not do them.
Yes.
Anal sex, because that place is not supposed to be for that. So the place is rough.
Yeah.
So it is very easy to get injured. And then your blood.
I think that is one of the highest ways. By the people who practice that mode of sex get it more, right?
It is 80% or 90%. You get. So, but people should not do that. I don't even like
talking about it.
It is unusual. So
these days people are making it usual, surprising.
Let them.
We're in a generation that is just funny. Continue.
And then some routes like shaking hands, hugs, you cannot get it. So people should not see me with HIV And when I give the hand, they just
Do I get infected through kissing?
maybe when the viral load is too high. That's when it can go to other body fluids. The saliva, the tears, the mucus from the nose. But again, someone to reach at that level is already down.
Yeah.
So really, why should you kiss someone?
Poison.
But it is unlikely. Then we want to talk about circumcision. And
Yes.
how it can be
Yeah,
used.
the links of some. There's a gentleman who posted. He's called.
It is a sure way of not
Calvin.
getting infected.
There's a lady posted and she was saying that she's proud that her man is circumcised because then the chances of getting HIV are less. So this guy goes and replies to this woman. He's called Kelvin Omkongo. He's on Twitter. And he's like, what are you teaching these girls? What is she saying? This is actually wrong. So that's where I want to find the distinction. What happened? How does HIV?
It is not a sure way of not getting HIV.
Okay. How does circumcision work?
So let's first talk about someone who is not circumcised. If you have seen, I don't know if you have seen, but someone who is not circumcised.
We have seen, don't mind.
Okay.
We have seen me and Edgar, we are Makua
Yes, I
people.
have seen.
Edgar, me and you are Makua people, we have seen.
When you pull back the foreskin on the, I don't know, should we say it, on the penis, it is very soft and fragile, very soft.
Yeah.
So, in case it is very easy for that part to get a kasoa or a kaun or anything. So during that time of having sex, maybe you find the cervix of the woman is somehow also having challenges or has high viral load and it is in the vaginal fluids.
Yeah.
It is very easy for the HIV to enter via that sore or a wound or what. But when you get circumcised, then it becomes skin like here.
Yeah.
So it is not easy to get a
HIV,
sore or any form that can.
And even the virus can actually, I hear, hide around that covering of the penis.
Yes, and it finds its way in. But it doesn't mean when you're circumcised, the virus that is in the woman's fluids cannot enter you via the urethra.
The urethra is the passage that takes the urine and sperm, right?
Yes. So it can enter.
Through that.
So it is not 100%. The people who made the study were saying 60% chance of not getting. And 60% is not a high percentage saying, I cannot get.
There is
So
a
you
40% you can actually get.
Get.
Okay, but then there are some people who are like who have the ability not to contract the condition. I've heard there are some people who actually cannot get HIV. How do these people come about it? Do they have a different kind of genetic makeup, DNA? What brings about that that ability?
Those guys of blood group or keep on bragging.
That is a wrong assumption, by the not blood group. Oh, it's not about blood group. It's about. I think it's about the quality of the immunity of an individual, right? And their genetic makeup. And there are few, by the way. There are not many. So
You see, there's what we call normal distribution curve. There are isolated cases, the outliers, and then we have the majority. So it is a very high chance for you to be in the majority, and very low chance to be in the outlier. So why should you take chance? We are talking about life. So whether there are people who cannot get, whether there are people who can get, but why should you focus on because blood group,
outliers? I am lucky.
Unless you prove it scientifically, but you cannot just say I'm part of this 1%. There is a very low likelihood. So when you come to me and I tell you, you say, Nyabo, I think after counseling and everything, we don't say it plain like that. I'm just for the program. And I tell you, you have. That's when you will understand, hey, I was not in the 1%. You see?
Yeah, and by the way, you know, there is a way things in this country are hidden in statistics. So people have gotten used to statistics too much that they don't know the magnitude of a problem. For example, they will say, let me see, 570 women get HIV every week, right? So that's a statistic. Until you're part of that 570 women, that's when you know. That's why you see people saying about, they stole billions. This person is okay. They stole billions. But when you break down the billions they have stolen, you realize that 1 billion has 1,000 millions. That's when you realize, hey, this person has taken a lot of money. Right? So Ugandans and the statistics.
Let's bring it in this context. In secondary, we used to do things as a group.
Thank you.
We are 20 people, so you do something, we are many. When they tell you, okay,
When
you
they
20,
sing or you out.
you 20 go home. When you reach outside the gate and you're the only
Everyone
one
is
going at
taking.
your home, that's when you will understand.
The power
you
of a
were alone.
statistic.
So I don't want people to have these statistics as an image to look at.
Yeah.
It is very easy to be part of.
That statistic.
Yes.
Very, very easy, by the way. Uganda
So-
should learn that.
Now, we are going to talk about, I don't know, mother to child transmission.
Yes.
Are you done with circumcision? You've maximized
I think
everything that Ugandans should
If there's
know?
anything we can
tugende
address.
ku mother child obudde butulesa
Kale,
tulina okuwa engeri abantu gye balina
Tewali
okwekuuma.
buzibu, tugende ku mother to child. Mother to
Now-
child transmission.
When a fetus is the baby growing.
The unborn.
Yes, growing inside. There's what we call an umbilical cord. So that umbilical cord, at some point, it protects the child from all the illnesses that the mother had. Some things do not cross the placenta.
Oh.
The placenta is this bond between the mother and the child. It feeds the baby, brings the excretus, all that. So a mother may have malaria and it cannot cross.
Yeah.
But it can be very severe and it crosses. That's why pregnant mothers are very delicate. You get a headache, run to the hospital. Don't buy Panadol. Some drugs are not used when you're pregnant. So I can use this platform to say, mothers, pregnant ones, stop self-medication.
Self-medication.
It is wrong and dangerous. So when a mother is pregnant, you have what we call antenatal care. 4 visits minimum, but you can go anytime you feel I'm not okay. So mandatory HIV testing is made during those visits. So we can prepare. If the mother is positive, then at delivery we must make sure
She doesn't.
she doesn't transfer to the baby. That's why it is advisable all the pregnant women to go to the hospital for delivery.
Bino ebyokuzaalira ewaka tebakyabyagala.
That is old age. Old stone, we called it old
Stone age
You
period.
should not deliver from home.
Home.
Because these health workers, the midwives, they have a technique of stopping because when the baby is out, then the placenta is no longer very firm to stop the mixing. So it is very easy for mother's blood to get mixed with the fetus blood. So there is a very crucial moment of breaking the cord.
Yeah.
You cut it, you stop the mixing. So if the blood is not mixed, then there's no way the baby will get HIV.
Just to add on that, babies make their own, they manufacture their own blood and everything,
Yes,
their organs and everything.
Yes.
God is really amazing.
So that's one stage where we prevent. But when you deliver from the village, the traditional birth attendant may not even know they're HIV positive. They will take their time. The baby is out, they first make the baby comfortable, then they can come back to cutting the cord.
The cord.
The blood is already mixed, the child is
Already infected.
infected.
Those are the cases we always hear of someone nazalibwa n'obulwadde. Nazalibwa n'obulwadde.
But we also have health workers who are, I don't know, not vigilant.
Reluctant.
We are not yet at a zero
Level.
level. When you deliver from the
Mother to
hospital,
child.
the child cannot get. We are not yet there, but we shall.
They're
get
careless. They are careless health workers.
Now, another point is through breastfeeding,
Yeah.
because the HIV might be in the
Breast.
The breast milk.
The breast
Yes.
milk.
So that's why when the mother is positive and the baby has survived from not getting the infection at birth, we advise you breastfeed for 6 months.
Tosuka myezi mukaaga.
Yes. And after 6 months, you can stop. Then you give the other food. But don't breastfeed and you give other food, because the gut of the baby is not yet fully
Developed.
functional.
At 6 months.
So, no.
Before
that.
6 months, yeah,
So
okay.
it is very easy to get injured, even after. So when it gets injured, then it is very easy for the HIV to join the blood. So you're supposed to breastfeed with nothing given to the baby
For 6 months.
for 6. Then also,
Is that also the genuine recommendation for women who are breastfeeding in order to feed their babies? Like, do they breastfeed for 5 months, 6,
Yes,
without
6,
giving
without
baby anything
giving.
else?
then after 6 months, you can
You
start
can start
giving
introducing
soft
them
food.
to soft foods.
We call it
And
weaning.
milk. But how about these women that don't have milk, don't have breast milk to satisfy these babies? How do they handle the situation?
We have baby formulas. But even if they don't afford, we always teach them on how to. So even when the baby has survived, we don't stop at that. We keep monitoring, because there's testing. We have serological test and virological. When a virus enters your body, the body fights back.
Yeah.
So it forms antibodies against the HIV. So when we do a serological test, we are looking for the antibodies. So these rapid tests we were talking about, they detect the antibodies. So when someone is in window period, the antibodies are not yet to the level where they can be detected. But the virological test, we look at the virus. We look for the virus's DNA. Yes. So even if it is 1 week,
you can see it.
Yes. So for those babies, we usually, before 18 months, we usually do virological tests. We look for the.
Right.
So the virological test is when you draw blood, right? But then you go and study that particular blood, not using these strips.
We usually, it is called dried blood samples. There we look for the virus itself, not the antibodies.
And it's different. For this strip looks at the antibodies,
For the
right?
antibodies.
So that means in order for a strip to work, the viral load has to be a bit high.
So we do tests. If the virological test is negative, then the child is negative. If it is positive, the child is positive.
Is there a way you can help this baby who has gotten that HIV through transmission? Let's say if we've detected that the mother and the blood of the child mixed when they were trying to give birth to the baby, and it's like a month down. Is there a way we can help this particular baby, this toddler? How do
First of all is to improve the quality of life. In babies, the immune system is not yet strong. So we don't want the baby to get the opportunistic infection. That's why we give a drug called cotrimoxazole or Septrin in common language. So the baby starts immediately.
In that phase, even if they are 1 month, they start,
Yes,
even if it's a week.
to prevent those. So even when we haven't confirmed that the baby is positive, but the baby is breastfeeding, the mother is positive, then we give cotrimoxazole.
In a case when this baby is positive, can they heal completely from
No,
HIV?
no. from the start we said when you get HIV,
You're
it is
gone.
for life. You're not gone.
It's for
You
life.
live with it for life. Yes.
Wow.
So when you deliver from hospital, higher chances that your baby will not get infected. So please, when you're pregnant, you have to go for those visits, the 4 of them. You get tested. We even look for syphilis, anything that can disturb the baby at delivery. So make sure you go for the visits. Don't deliver from home.
And the men should go with the women. This issue of leaving the women to go alone is also not good.
That's very important because parenting is for 2 people.
Yeah, not one.
Not one. So when one chooses to do it, then that is not proper. So someone should support the other. Then they can do it together.
All right.
Okay, katugenda kutunuulira ndowooza omuntu yeekuumya atya obutafuna akalwadde kano.
Abakatwega takutukyali ku Mighty Drive by the way. Embozi omanye omutandikuka ku mbozi zino. The mood goes down.
Yeah.
These issues are issues that are
abadde
pertinent.
wano ng'ayogera nti yawulira abasawo bagamba bambi he looks innocent. N'anzijukiza eyagamba mbu he had slept with someone and then when he got back n'akomawo n'awulira nga abasajja babiri boogera muwala oyo mulungi naye ebbaawe bulwadde kyokka nga he had just slept with the woman. So n'agamba yatandikirawo okulaba sayini zonna z'atandikira omutwe nga gumuluma awulira ka fever.
And I'm realizing HIV is a condition that is in the mind. It's a mind thing. When yes, it can be there in your blood system, but there is a way the blood. You see, people don't understand, but the body is broken down into 3. There is the body, there is the mind, there is the spirit. So when one has already been exposed to a challenge, and the mind also believes that the challenge is there, you start to see the signs there and then, right? Because your mind did not know that you had HIV. When your mind realized you had HIV, and that's when you start, that's when you go in your heart, no chikiza, no gamba, now I'm gone. I'm dead. You're going to die in a month. I am telling you. But even when you get HIV, for a long time, but your spirit is saying, I am not dying because of HIV. I have seen people die at 80 when they have HIV.
That's why.
They have lived with HIV for like 40 years. And this person is strong.
That's why I was saying, even if you know in the past 1 year or 2 years, you have not slept with anyone. When you come to me for a blood test, you're not going to stay the same at that waiting chair.
Yes, you cannot.
What if? So even when the Wasawas are passing and they are judging their own things,
you think they are on you, you have a guilty
they are
conscience.
talking about me. I think there is. So that's how it can torture psychologically.
Yeah.
That's the kind of the disease we are dealing with.
But Ugandans should understand prevention is better than cure. And when you get HIV, does not mean that you're gone. Let's start from there. How do we, first of all, let's talk about the curative patterns before we even look. There are no curative patterns, by the way. You just cope with the condition, right?
No, we have drugs that can...
They are coping mechanisms.
They can help you live for some time.
Not help, they regulate the
They help you live for some time.
The doctor is just changing words and bringing them in a professional way. You're just being good.
Just as if we are for some
You're
time.
buying more time.
You are not going to get healed of HIV.
You're not going to. But trust me, people who don't have HIV, that's why I want us to look at when you're infected, holistically. I don't want people to think when I'm infected, I'm gone. Because death is... Some guy was telling us that for you fear to join the army because you think you're going to die. How many people die and they are not in the army? So come to HIV. How many people die when they have no HIV?
Many. You can just move outside here.
How many people die in accidents, die of malaria, diabetes, hypertension, all that?
Non-communicable diseases.
Yes.
And you can still have HIV and die in an accident.
And you can still have no HIV and die. So I want people who already have the HIV.
Yes.
People have already gotten the virus.
Yes.
Don't give up on life. Because at least we have, it is not like long ago when it had just started. People could, we call it natural history of disease. A disease manifests itself up to the time it kills you without intervention. But right now we have ARVs. And trust me, when you're starting to take them, it is not easy. Side effects are there, you don't have energy, you feel weak, you don't do your work properly, but that's for like 1 month. Then after, your body gets used, the virus goes down, the CD4 cells go up, and you live normal life. Just adhere, keep taking. The moment you stop taking, then you're awakening the virus which is asleep. That's where the iris comes in. If you have pneumonia or syphilis, it is not so much. It is not so much because the ARVs are helping your body's immune system to fight back. Then now you stop taking for 6 months. It multiplies. Then you start taking again. There is a war between your immune system and the virus. So your body gets weaker. This time the virus is above your immune system. So as it is attacking you, then the syphilis is gaining momentum. That's why you say when someone leaves taking and they again come back, it is worse. So, but some really get care and they stabilize and they go back to normal life. But why should you come to that? If you're infected, go to a health professional. They will counsel you. They will advise you. Personally, I've talked to people. I give them results and they feel it is the end of the world. But I give myself time with them, even if it is months. We talk until that person feels it is a disease like any other. And they live up to now. And they are okay. So, if you have HIV, it is not a death sentence. You can live quality life, you look after your people, you suppress the virus, you can even give a testimony that you healed.
In church?
In church. But don't say,
it is still there.
It is still there, but it is asleep. So that's how these ARVs are very important.
Wow. So other solutions, how do we prevent HIV? Because we're coming to the end, I think our time is done.
So briefly, the ABC, it is the best choice.
You add on a Kadi like Zimbabwe.
I don't want because
okay, let's not.
So ABC, when you're not yet married, like me, I don't know but if you're not yet married.
No, Motoro is not married. We are not married.
So we are not married.
We are not married.
Abstain. Abstain. However hard it is, however simple it is, abstain. And if you're married, or you're in a relationship,
I understand.
or you're in a relationship, please be faithful. Because before you get married, you first go and do a test. Then we confirm both of you are.
But how does this be faithful work in Muslim people who have for wives?
As long as all of them are negative and you're faithful
wives,
to all of them.
Yes, there's no way
they are
someone is
faithful
going to
to
enter your circle.
If both of you are faithful to each other.
Because
if are faithful
I
to
thought
the man.
faithfulness works for two people.
No,
Yes.
it is a different set.
I am being faithful to all of you.
All of them.
I'm not getting
So if you don't go aside and you pick it, then all of you will remain okay. So be faithful. Before you start anything, you first test, go to a health worker, you confirm, not these rapid tests, please, you're going to get HIV from these rapid tests. First go, confirm both of you are negative. Then, when you're faithful, you have that only one person. There's no HIV is going to enter you. Unless you're a health worker and you get an accident. Then, if you cannot, I don't know why you shouldn't, but if you feel you cannot, then C comes in. Use condoms. Some people say they are not effective, but they are effective.
They are effective in what they do. They are not effective to the user.
No, like there was somehow there is a way you get infected even when you
when you use it properly.
I think it's like 98%.
There's no way you can. And some people say I've double graved, I've triple, they put 3 or 4. That is not necessary. Only one can work.
That can also
By
be
the
yes.
moment you put 3, that means you shouldn't be doing what you're doing.
Now,
you shouldn't be doing what you're doing.
Then, as I'm winding up,
yes, please.
I have a teacher who taught me a very interesting thing. She's called Teacher Gertrude. She was my primary teacher. So, as we were talking, she said, the best way to avoid getting HIV is treat each person you see as a positive person.
You're the only
they
one
are not
who's negative.
Oh, they are. You don't know. But for you, take them to be positive.
They are.
So before you get tempted, sleep with them or do anything, you first take precaution.
Yeah.
So that is very important.
Waliwo comment wano kansome omukulu agamba there is a new HIV testing kit of the mouth. How effective is it? And yet you said unless the viral load is high, is when the virus can be transmitted to the saliva and fluids.
It can detect. It depends on the sensitivity. It can detect it. It may not. But that is also a self-test. Personally.
Of the mouth.
Yes, you do it yourself. Personally, I'm against self-testing. Because you do not have the knowledge the health workers have. So the best thing is go to a health worker
and test.
Leave alone, because it is not expensive.
I think abantu bewala bunkenko with those 10-15 minutes zobera otudde awo ng'olinda.
But trust me, when you put your blood on the thing, on the rapid test, are you going to run away?
No, at least I am seeing as it is moving. There was a friend of mine, she's a practicing nurse, so she was telling us a story like this guy went in to test, and then before they could even tell him you are positive or negative, he stood up. I knew that girl would infect me. I knew. So why are you sleeping with people you are not sure whether they are positive or negative? And then you start telling
people take sex as a joke. It's not something they take part in it.
Then we come back to the statistic. Young girl. Please. I already said there is more to life than these material things. The transition. You want to go to the band, you're the one holding the big
expensive
bottle.
wines.
You know, people fear, the girls fear pregnancies more than they fear HIV.
And that is absurd.
They don't listen.
And trust me, like how you are saying it, you're going to do it in a group. And you're going to make your jokes. If I get it, hey. But the moment you get it, trust me, it is a different story.
You are part of the statistic.
You need to be the psychologically
you are part of the statistic now
to move on. So please, let's try to avoid.
All right.
And
lastly, Dr. Barigye, as we come to the end.
So people are not yet infected. Let's try hard to make sure we don't acquire the virus. People who are infected, please, it is not the end. Like we said, if people are not positive, they die. So please, visit the health worker, they do the necessary tests, adhere to your treatment, eat well, accept that it has happened, you cannot reverse it.
Okay.
By the way, what is eating well mu lulimi lw'okisawo? Because if you're eating well, tumanyi kulya nnyama, nkoko, chipsi.
No, we have different classes, carbohydrates, proteins, all of that. When you go, they will teach you how to eat well. Eating well is not only eating meat. That is not even eating well.
Okay.
So my final advice would be, let us all come together holistically. It is not for medical workers only. Everyone is involved. Let's fight this.
Okay.
The only way we can slow down on the new infections, improving the quality of life, it is making sure we reduce on the new infections.
Okay.
So let's come together. The religious leaders teach your people, give platforms so that people get information. We remove these misconceptions of when we do it standing up, I cannot get it.
So when you do it and then after you jump, you don't get it.
We need to remove
have some assertions. Doctor, give them your contact as in just 20 seconds in case anybody wants to contact you to find out more about HIV.
My number 0789 13 7981.
Cut them.
0789 13 7981.
Okay.
And I'm available for any information.
Are you on social media these days? These the girls are tweets and tweets.
Yes. On Twitter, my handle, they are just my names at Bonnie Barigye.
Okay.
On Facebook, they are my names. Okay. I think those are the only ones I'm on.
Okay. It's not. Is it Bonaventure? Is it
no?
Bonnie?
It ends there.
Bonnie.
My parents called me that.
Bonnie.
Bonnie.
Kale Bonnie. Thank you so much, Mr. Barigye Bonnie, for coming through. It's been a pleasure having you. We can't wait to have you again here on the Mighty Drive. Farida, thank you so much for joining us. And of course, a special thank you to our viewers today for tuning in. Today we're going to be having Tekachi that happens at 11 a.m. It's a show that talks about the law. And of course, today we have a very ardent advocate of the High Court. That is Mr. Kanso Kakuru Tumusime. Yes, you're going to be assessing the state of justice systems in Uganda today. And Kanso Kakuru Tumusime will be right here on the Mighty Drive. Don't miss out that particular edition at 11 a.m. It will be happening right here on the Mighty Drive. It's been a pleasure having you on the show. We shall meet tomorrow. I'll be talking about Argentina. By the Friday, I will be telling us what will have happened between Argentina and Croatia, a match that is very, very highly anticipated by various Ugandans. Thank you so much. My name is Edgar Matthew Karuhanga. We have 2 minutes to the top of the hour. Enjoy the rest of your morning. It's a cold morning. Make sure you carry yourself a jacket, a sweater, an umbrella, or anything that is going to help you in this cold weather. And of course, in this cold weather, don't forget that Pampers are more expensive than coffee. Buy yourself coffee. Good morning, Uganda.
The Alternative Digitalk. Real issues, real talk.